And a wonderful good day to you. I would like to, first of all, acknowledge Professional Fusion for the kindness of allowing me to be with you today. And secondly, I'd like to talk about the necessity for pre-year-end fitness. And the fitness that I'm making reference to are both personal as well as practice. In any profession, you're so focused in on the needs of either your client or your patient that, or as in veterinary medicine, your client and your patient, that you forget sometimes the importance of keeping that person or people who are so critical, mission critical to the continuation of your practice. And I'm specifically speaking to the practice owners, the practice administrators, the associate doctors and the technicians, or hygienists, or chairsides, or nurse practitioners, or physician's assistants. You are the individuals that probably don't worry too much about your own health, but you really are on tune with the needs of others. So the first thing I would suggest is try to get an appointment before year end. And it's a tough time, ladies and gentlemen, because insurance usually goes back to zero in terms of deductibles. That's why most people try to get in before the end of the year to get a checkup about yourself. Now, the main sources and the main income streams. For me, eyes are very important because that's how I spend my time. That's how I interpret things. So as a result of that, I had cataract surgery, and I cannot tell you the difference, the unbelievable technology opportunities that exist. So if you're at that stage, your life will change completely. Now, this unfortunately requires time. If you have chosen to have replacement lens in the eye that can be adjusted after the operation, you have to keep going back to your ophthalmologist. And I think it's well worth it. I know it was for me because my eyes are the portals of my ability to serve my clients. Second issue, hearing. And as we all age gray, paunch, and bald, especially men, hearing is degraded, especially with myself. And it becomes an important feature. Now, there's a couple things that I've learned from it. Number one, I'm amazed at the amount of the population that we employ in all the professions that speak softly. And speaking softly may be fashionable, may be the way that a person communicates. But if you're trying to get a message out to somebody else, a patient, a client, just the public as a whole, you have to learn to project and to enunciate and to speak slowly. Fast talkers may be fashionable, but fast talkers only belong in agenda-driven politics. In hopes of trying to communicate, fast talkers have no use. So try to teach your staff the importance of speaking clearly and distinctly, and making sure that they understand the purpose of communication is not to be fashionable, but rather to communicate to others, especially the elderly. And unfortunately, at age 72, I'm getting close to that class, if not in it. And I can assure you that the ability to understand another person, especially when they make the effort to enunciate and to speak clearly and distinctly, also provides thought in the communication. When you speak too fast, there's a lot of gibberish. And people often will discount or dismiss your commentary because it just can't be heard. So as a result of that, teach your staff and yourself to speak clearly and distinctly. Then the way that you dress is an important feature. About 35 years ago, there was one person from an area near Dayton, Ohio, that was also a client, and did an analysis, a color analysis of me. And then based on the classic winter, spring, summer, and fall, gave me guidance as to what type of colors would be most important. Well, it was somewhat intuitive, I have to admit, because at one time I had blonde hair and blue eyes. It's now a little bit of mixture, a touch of blonde and a lot of gray, and just the ability to keep the hair. But it really did help in terms of buying things, of what is more presentable to the person. So if you have in your area a person who does that kind of thing, you may want to look at it. There's a person that popped up in the videos, again, the daughter of a client, but she does color analysis. And men and women, I'd strongly encourage you to try it because it does give you a perspective. And then finally, the circulatory and the respiratory system. Big killer. The circulatory system obviously is best suited if you don't smoke. But at least go to your doctor. Maybe even take some tests to see how you're doing. I have a pulmonary specialist that I consult with at Mayo Clinic, and she does a phenomenal job and keeps track of where things are going. But lungs are a very important feature. And then finally, the heart. And the heart is something that is a silent killer. So if there is the availability, especially they have these traveling medical groups that will do a whole slew of diagnostic tests for a pittance of cost, I'd strongly encourage you to consider them. And then it's very important to see your physician and to know that you have someone who remembers your historical perspective. So I would strongly encourage that. And then don't forget the most important part of health is the ability to consume the right kind of food. That was most recently put into spotlight in the United States by the son of one of our greatest political figures of the 1960s. So I really do believe that you want to be careful about what you eat, your diet. And then finally, the last thing that I could put in as a recommendation is a physical therapist. Unbelievable assistance. Now, I just had my knee replaced, so I took pre and post physical therapy. I'm still doing a little bit of it, but it really has made a big difference. And the other thing that I notice is your core, your capacity to maintain that balance and to stay active. If you can't walk a lot, consider riding bikes. Bikes can be dangerous, though, because a lot of the motorists don't necessarily follow through. Now, why am I saying all these things in something that relates to a video about practices? Because it's an inventory of man hours that you sell. And that inventory of man hours, if it's not available because you're sick, has become even more critical because it's tough now, especially in certain professions. In the medical professions, veterinary medicine, dentistry, dermatologists, cardiologists, internists, orthopedic surgeons, orthopedists. I mean, I could go on forever and ever, ophthalmologists, but there's not a lot of them around. And there's a couple reasons for it. They're making good money. They don't have to work as many man hours a week. And the other factor is they're retiring way too early. So as a result of that, it's getting to be difficult to find people. You will have difficulty in trying to replace you and other people in your practice. I'm devoting the same kind of commentary to you. Watch what you do. Try to stay in the best possible physical condition. All of you know how to take a blood pressure. There are very simple cuffs that you can use. Monitor those things. And be in communication with your doctor. I know you may be a doctor. Most probably are if you're listening to this podcast. But have the humility to know that you need to consult. Now, in accounting, as a certified public accountant, I am in desperate need to try to find great people. So I try to stay in tune because it would be very difficult to replace me. My son, Hugh, has the same issue. We try to make sure that medically we're on top of our game so we can be there to serve our clients. There's only one profession I can think of where there's not a shortage. But everybody else, it's really tight. So don't confuse a profession with an occupation. Understand how critical it is that you maintain your own health, because trying to find the right kind of people has become so difficult. And I say that for all of those that assist you in your noble endeavors, because they themselves are in the same boat. All right, so just a few ideas. Probably you know each and every one of these. This is nothing more than a reminder. Maybe some of you will hear this and put on speed dial some of the people that you should be seeing. Try to do it now, especially before we get into a new year where there's going to be insurance deductibles that have to be met. And do things to take care of you. And I know you have to take care of everybody else and that you're the last on the totem pole. But if you're brought from this life to a better one, you're not going to be here to help us. So with that, I'd like to say thank you very much. Do really appreciate all that you do. This is Owen McCafferty. Take care.